Welcome. We're going to talk about staffing your center. And this is the disclosure statement, so you can all read that, and it should be all included in your slides, so I'm not going to go over that. But I will be talking about the objectives. And so we need to make sure that we look at what kind of staffing do you need for an urgent care center, as opposed to a blended clinic model, an occupational health program. I'm just talking about urgent care centers, okay? We're going to look at scope of practice. How many of you have written your scope of practice already for your urgent care centers? Okay, one genius. Then we're going to talk about competency. We're going to talk about orientation. We're going to talk about how do you determine productivity. And we're going to talk about mid-level provider relationships, okay? How many of you already have your medical director and your program director in place? Quite a few of you. Okay, those are two key positions. All right, so I share with you on the slide some urgent care facts, because I think it's really important for you to recognize that in the market where you have chosen to put your urgent care, if competition isn't high right now, it soon will be. There's currently over 9,000 urgent care centers in the United States, and there's an anticipated 700 to 800 annually across the country. That's high. That's high. And I think you're going to see even more with the new practice parameters coming down with or without Obamacare. So you want to make sure that your staffing is right in your clinics to give you the best advantage over your competitors, and to make sure that you're going to be able to have a positive revenue stream. Because what? Whoops, excuse me. Let me go back. Okay. Hold on a minute, people. My slides are out of order. But that's okay. We'll use these slides since they're up there. So I have to look at them to see what's what. Okay. So what's your staff mix? What positions are you going to have to hire? How many do you need? So how many hours are you going to be open for? What does your State Practice Act advise as to the credentials of the people who can perform the practices, policies, procedures, competencies in your clinics? And where do you start? Well, this is the nurse of the future that's already in Korea and Japan. And the beauty of this nurse droid, whoops, is that she works very carefully in an extended care facility, and she has the parameters to be able to detect a soiled diaper. Unfortunately, we don't have any nurse droids for urgent care, so you're going to have to hire real people. Now, in my last session, they shared with me that they have some robotic nurses there, but they're not in the droid format. They're in the human format, and their patient experience skills were minimal. So we don't want to function with droids. We want to function with real people. And so that's why it's so important for you to hire the right people in your clinic. Now, this is a new telemedicine component, and you may see these in local hospitals. These are robotics that can go to the bedside so that when the provider can't be there, he can talk to patients who are in hospitals. And these work very, very well. We don't have any of these robotics in urgent care yet either. We just have walk-and talking doctors. So we have to make sure that they're going to be where we need them. So your staffing and scheduling is really very, very important in the urgent care setting. Staffing and scheduling should be one of the first discussions you have when you're looking for providers. This is W.J. Mayo in 1910 was talking about the patient experience. And I think this is so important because when you're hiring people, you have to be really in tuned that they know what your primary concern is about customer service and a positive patient experience. So here, Mayo said, the best interest of the patient is the only interest to be considered. And in order that the sick may have the benefit of advancing knowledge, union of forces is necessary. It has become necessary to develop medicine as a cooperative science. I put this up here because when you're building your staff, you're building a team. And so if you hire people that have no concept about being a team member, you're already behind the eight ball. And it starts at the top. It starts at the very, very top. So you need to make sure that the administration that you have are part of the team. Okay, nobody is a silo. It's a team focus. And that's why we look at hiring the right people. And you should have lots of them, because this is an article that was in the April 30th, 2013, Healthcare Insights and Trends by Jason Lovelace. And he said 34% of healthcare workers plan to look for a new job in 2013. So they're out there. You can get them, okay, to join your staff. You want to make sure, though, that you get the right ones. All right? So we need to make sure that we define the techniques for hiring and for candidate selection. We want to establish who we need to hire, okay? And we want to look at the best way to find them. What are some of the best ways of finding them? Where would you go to look for recruiting staff? Headhunters, maybe? Local newspapers? If I wanted to have my urgent care be part of the community, I would want to get the commitment of community members. So it might be good for me to hire a provider that lives in that community, that has some networking already, or an MA that has 50 million relatives in the community that she could stop bringing them in the first week. Okay? So we want to do that, but we also want to make sure that we have clearly defined parameters for our hiring techniques. How many of you are part of a hospital structure? Okay, so those that are in a hospital structured system have HR that clearly defines the parameters for this is what you got to do to hire a provider, and this is what you have to do to hire everybody else. And those of you that are in private urgent care center development have to develop your own policy, practices, and procedures for hiring. So I would urge you to make sure that you establish the credentials you're looking for in a provider, or the credentials you're looking for and the experience required for a nurse practitioner or a PA. And so if you're going to solicit staffing through a headhunter, it's clearly defined. The other thing that you're going to need to do before you search for staff is have clearly designated job descriptions. How many of you have already listed your job descriptions? Developed them? Good. So that's really, really important. Now, part of your State Practice Act will define who you can hire to do what. Because the State Practice Act, as this defines, tells you for patient safety, these are the credentials and the competencies and the education that we accept in our state for practitioners to be able to take care of patients here. So some State Practice Acts say you have to be a registered radiology technician in order to take x-rays in our state. Others would accept MAs with special training. In some states, you have to have a registered nurse to do immunizations. In other states, you can use either a licensed practical nurse, some states call them licensed, an LVN, or you can use an MA. That makes a big difference to you. Why does that make a big difference to you? Well, because that's how you're going to determine your staff mix, and then that's how you're going to go and look for who you need for staff. If you're in a state where an MA can take x-rays and do immunizations, then you're really at an advantage because you can clearly define policies, procedures, and competencies, and your staffing ratios would be far less expensive than if you're in a state where you have to have registered nurses and radiology techs, because the salaries then are going to be a lot higher. So that's why I'm going into this, because I think it's so important for you to be familiar with what your State Practice Act says, because many clinics will use this as a differentiator when they're in competition in the market. Now, some urgent care centers will say, we only use physicians to care for our patients. I think they're all going to be changing that tune frequently, because as you need to expand your hours, you're going to consider, I think, a good advantage of using advanced practice practitioners, nurse practitioners or physician assistants. I'm slightly prejudiced since I'm a nurse practitioner, but I'm not practicing anymore, so I say this in all honesty. I think you can get an excellent family practitioner, nurse practitioner, to help you in your practice. They do very, very well with peds, and they do an exceptional job with elders, because we've been trained to do that. So that's just an option for you. Okay. So we need to have our designated job descriptions. Make sure that they list the respective roles, the task list, the competencies that are going to be required for that job description, the productivity indicators. Okay? Now, why do you need productivity indicators? Why do you need productivity indicators? You can measure how they're doing. Is that what I almost heard you say? Okay. Thank you. I have a cold, so my hearing is way off, and I apologize for that. So let me know how it's going. So why else would you want to have productivity indicators? You can benchmark your practice. Excellent. So that you can show if someone is functioning at one level and someone is functioning at another level, who maybe can be coached. So you're standardizing your care throughout your practice so everybody's functioning at the same level. Because what does productivity drive? Ultimately, it drives your wait times. Okay? If you have slowpoke Sarah, that it takes 20 minutes for her to do some kind of a test, and Happy Hannah, that it takes her 8 minutes to do the test, you're going to be able to process your patients through a lot more quickly with Happy Hannah than you are slowpoke Sarah. So productivity measures need to be identified. And with that, you can develop incentive programs. How many of you have thought of having an incentive program within your structure? Good. Why? Well, an incentive program pays people to do more than minimum. Okay? So you don't get an incentive if you follow your job description and just do normal and regular. But we want people to do more, and so we're willing to pay for that. And if we make more money, we can afford then to give them an incentive so they get more money. And incentives should be, in my opinion, for the whole staff. Because what are we trying to build? A team. Remember, there's no I in team. So we're trying to build a team. We're not just trying to build one person who's going to work his best to get his incentive. We want everybody to work their best to get their incentive. Okay? And then identify performance criteria that's tied to what you expect for best practice and a positive patient experience, that whole customer service model. And then clear expectations of when you're going to review them. They should know that when you're hiring them. What are your expectations? This is the job. This is what I'm paying you for. This is how I'm going to measure you. This is how fast I want you to work. And this is what I'm going to how soon I'm going to review you. Very clearly defined in the job description. So now you're going to search for a staff. You're going to research candidates' credentials and do background checks. And now, are we ready to start hiring? Not quite. First, we have to set up our interviewing process. And we have to have people who are going to do the interviewing. So if you haven't hired anybody yet, who's going to do all the interviewing? You are. So I would strongly suggest that one of your first staff that you go out to get is a medical director and a program director, because then they should be responsible for working with you to hire the staff. The first components of team. There's no team in 2. It takes 3 or more. Okay? 2 is a partnership. 3 is the beginning of the team. So here are some interviewing questions that I put here. Very basic, but it kind of draws from your candidates who they are. Okay? And it tells you a little bit about themselves. I think this is really important. You want to know who you're dealing with. It's sad and very, very expensive to hire somebody, put them through orientation, and then say, you know, this person isn't really who I thought they were. Now, maybe had you asked certain questions in the interview process, you might have been able to dig that out. And maybe not. But still, at least you have more of a percentage here to finding out who these people are. Why should I hire you? What do you bring to this job above other candidates? Now, this means the person doing the interviewing has to know the importance of the job they're interviewing to be filled. Okay? So that's why I say it's important to have both the medical director and the program director as part of the staff interviewing process. What other questions do you think are really important in the initial interviewing process that you have put in your standards for interviewing? Anybody want to share? Yes. Okay, so what the participant said is this is a retail business, and how do you think you're going to be able to help us encourage patients not only to come once, but come back again and maybe even share about our services to their family members and stuff? That's a good point. I think that looking at that as a retail component and not as a missionary out in the community to provide health care to the multitude is really important. Because you'd be amazed at some people who've worked in a hospital setting, they want to get out of it. They may go and apply for a job in an urgent care setting because they don't have to have that 24-hour yet responsibility, but they're thinking of it from a hospital perspective and not a retail perspective. And their interactions with patients is very different. Because in urgent care, the patients don't care about morbidity and mortality rates. They care about how you make them feel and how you treated them. Okay? So that's really important. You want to make sure you hire people who have that customer service focus. So you need to pull that out of them. So I like behavioral interview questions added into the spectrum too. And I've chosen 4 sets. On this slide you see customer service and critical thinking. Customer service because patients don't have to come to you. They select you. And so in order for them to come back, and in order for them to be the best marketing tool that you could possibly have, they have to have a very positive experience. So you need to get people who are friendly, who are customer service oriented, not only during the interview, but when they're working in your clinic. So you need to ferret that out, okay? Because one of the most depressing components is to think you really nailed an excellent employee, and then the day you open your clinic, they're less than the greatest thing you've ever seen. Then you're going to have to do an awful lot of gardening and weeding. In my clinics, we we consider weeding, evaluating all those weeds who aren't performing appropriately and not very productive and being able to get rid of them in a timely manner. Then we have to start this process all over again. Okay? Very, very time consuming. And over the years, I opened my first clinic in 1975. And things have changed dramatically since then. But it's still, urgent care is a customer service business. Without customer service, your patient experience is going to be negative. And so you want to make sure that you hire people who have the same value that you do towards patient care and patient service. So these customer service questions, I think, can be helpful. You can add others to that, but there needs to be a component of the interview process that covers customer service and critical thinking. Why? Some patients who come into an urgent care center because of the low cost, because of easy accessibility, should really be in the emergency department. And so you need to have staff who can really determine through appropriate critical thinking skills who's what. You also need to be able to have people from the front desk to the discharge nurse who are able to alleviate patients' fears and be able to pick up when somebody needs more than what they appear to have gotten from the provider. That's critical. So critical thinking skills are essential in an urgent care setting. So these are just some components that you can add to your spectrum. Team player. I said you needed to have a team who are caring for these patients. So these are some questions you can put in your queue about being a team player. And then management and leadership. Well, who do you think you should ask the management and leadership questions to? Anybody? A program director? Okay. Who else? What do you think about the MA? I suggest to you that I think management and leadership interviewing skills should go to all staff that you're thinking of hiring, because those skills might be so you can grow more leaders for the future. Now, how many of you are just starting your first urgent care? Okay. And how many of you have multiple urgent cares? Quite a few of you. I submit to you that as starting your first, use that staff as the model, because they then, when you start number 2 urgent care and number 3 urgent care, can be the training tools for the future. You can use them to be your interviewers for the next urgent care. Okay, they work very, very well. So you want to pick the ones in the staff through the management and leadership skills who can do that appropriately. So that's an excellent way. The first clinic is your model, and so you're going to build on that for when you go to your second and third clinic. Because if you do it right, you'll be bitten, and so you'll want to expand. It's been my experience that in dealing with people who started with one urgent care center, I have some that I've seen over time that they now have 7, 10, 12, and they're growing, okay? And I think with the way medicine is moving, you're going to see more and more and more of them. That's why over 700 to 800 urgent care centers are developed every year. Staff development and training. I urge you to have these models before you hire. You need to know what kind of an orientation program are you going to have. Well, if you look at orientation, it says to the staff, this is what we expect you to do in our clinic. So you have a management focus about the vision and the mission and what you want to do and your strategic alignment. And then you have the clinical component and you have the clerical component. Everybody should sit in on the mission, the vision, and the values. You should orient your staff, if you're a brand new startup for the first clinic, orient everybody on day 1 with the vision and the mission, etc. and then split them up into the clinical and the clerical. Okay? So your business manager takes care of the clerical, and your medical director takes care of the clinical. I urge you to have your providers, your MAs, and whatever your State Practice Act allows you to have, RNs, etc., in the clinical model. So that means that before you hire all these docs, etc., you have to have your standards of care written. Okay? So how are you going to know what standards of care you need? I urge you to look at your Department of Public Health report in your area that lists the top diagnoses for health issues. That'll tell you whether you're going to see a lot of diabetic patients, cardiac patients, cancer patients. The UCAOA does a lot of reviews and reports, and they've reported that the #1 diagnosis coming through urgent care centers is upper respiratory. So you all know that you'll need a lot of Kleenex and masks and need to be in tune to that. So you need a standard of care #1 for that. You will know once you do your market analysis whether you have a lot of asthmatics in your community. And that will drive whether you're going to need to do spirometry or you're not going to need to do spirometry. If congestive heart failure is a big deal, then you're also going to know about what kind of care and standards you're going to need. Okay? It'll also drive your physician referral panel. And that's up to owners to work with the medical directors to establish your physician referral panel. So you'll know who to send where. The biggest thing in any physician referral panel is to make sure that their patient satisfaction outcomes are good, or your patient's experience will become negative. Because if you send someone to a physician and he doesn't provide a good experience for the patient, it reflects on you. So as a new clinic, make sure you have a decent physician referral panel and you know what their outcomes are. Staff certifications are something that are the core to performance. Now, I may want to hire an MA because the MA, he presented with a very positive customer service approach. He's had excellent references. He's worked in other urgent care centers. He just wanted to make a move. He stays at the urgent care center from anywhere from 7 to 10 years, so that's good for me. As a startup, that would be really nice. And I want him. But unfortunately, I'm in California, and he let his phlebotomy certification lapse. So I'm going to have to pay for him to go back and get it. It's a $700 bill. Okay? But I'm willing to pay for that. But you may not be, depending on your financial status. So you need to make sure that when you're hiring somebody, they bring in, on the second interview, they bring credentials about their certifications being up to date. Okay? That'll save you some money. Okay, these are the common certifications and proficiencies that you need in an urgent care center. The first line, computer training, that's the biggest deal. Because if you're, how many of you have already purchased a computer system? A couple of you, okay? It's absolutely imperative that when you purchase your computer system, you have established ample staff training before you open your doors. Because you don't want the doctor saying, well, I don't know how to use this computer system when the patient comes through and they're facing one another. You don't want the receptionist not to take 20 minutes to register a patient. Okay? You have to set up enough time in your development process for the computer purchase and then training. And whatever computer system you're looking at, and there are a few out there, a few very, very well known, you make sure you check with the clients that have already purchased the system to see how long it took them to get their providers and staff up to speed. Okay? That's a very, very important research component for you. Now, once they're up to speed, then you can open your doors. But that's the number one training component. That's the most time-consuming. That's the most frustrating. All right? And your billing people, you need to make sure that they're very proficient in the whole billing and coding process. Because people, if you can't get the bill out, what's not coming in? Money. Okay? No bill, no money. So it's really important. The other things, depending on your market, will depend on whether you're going to do urine drug testing and whether you'll need certification. Currently, in the United States, the Department of Transportation mandates that the doctor doing an exam by April of 2014 has to be certified to do a DOT physical. So if you're going to do those, then your providers need to be certified. They also require that your MAs be certified to do DOT urine drug collection. They also require what they call breath alcohol testing. So if you're in a high trucking lane, you want to make sure you have these components in your clinic because they'll stop by. And they're good generators of revenue. Most of the, a lot of the truckers are self-pay, and they'll pay by credit card. But then a lot of the trucking companies also set up really good reimbursement for them. So that's a good revenue stream. Also, schools now are using urgent care centers to do substance abuse testing on some of their sports figures. They don't need to be, your clinicians don't need to be certified to do the urine collection, but I recommend you certify all of your clinicians through DOT and then say that that's the standard nationally and that's your standard. And I think that's an excellent marketing tool, that your people are certified by the DOT to do things. Different states have different rules. I mentioned California requires certification for phlebotomy, but not all states require that. You need to make sure you look at your Practice Act to see if your state needs that. Pulmonary screening and spirometry. Just for asthmatics, etc., there's no special training. But if you're going and you're in a manufacturing component, your clinicians need to be certified by NIOSH to do regulatory compliance spirometry for employers. That's a $1,500 cost. But if you hire someone that's already certified and their certification is up to speed, and you found that out on interview, then you're all set. And then visionometer, lifting tests, EKG, and TB screening. Those are just some of the things. Cross-train everybody. Like who? Well, everybody. So everybody should know how to do a drug screen. Everybody should know how to do a breath alcohol test. Those are non-invasive types of tests. Okay? Very easy to do. The rest may be a little more specific. Okay? Everyone, though, should be trained in the computer on how to register a patient and how to discharge a patient. If you're going to go into a blended model like you're going to do some primary care in your urgent care centers, we're seeing that now across the board, where if you're in a market where there are no primary care docs or primary care physicians have closed their practices, then you get somebody who comes in with an elevated blood pressure, not emergency department numbers, but they really need a little bit of follow-through. And you may want to see those patients. Number one, you're going to have to bill them differently because that's not going to be an urgent care visit on the second one. And number two, you need to have the appropriate standards of care and policies in your clinic to be able to do that. So you need to make sure all of your providers are aware of that, what they need to do, how they need to code it, and how it's going to be billed. That's really important. I like the dyad management model. And it says you have a physician who's in charge of the clinical component, and you have a non-physician in charge of the business management component. Now, they have to have some commonalities. You can't have two people who don't have the same mission being in a dyad, then you've got a mess. So you want to make sure that when you choose your medical director, or if you are the medical director and you're going to function as such, that you get your program manager who believes in what you're doing and understands all about the mission, the values, and the vision of your practice. Okay? Then you can look at the specific responsibilities that the physician leader has. Why would I say have a medical director as a physician leader who is going to do all this and list those responsibilities? Because I think peer review is very important, and as a dyad management model, the non-physician and the physician need to evaluate each other. So they need to know what the responsibilities are so everybody's clear on their roles. So I don't want the non-physician looking at the physician and say, you know, this quality stuff isn't necessary. The doctors are spending too much time on chart reviews. Not your call. All right? So it's written and everybody's aware of the different responsibilities. And I put these here. I'm not going to go through them unless someone sees a blaring something they want to ask me about. The only thing I'm going to tell you is providing for physician continuing education and skill building and encouraging clinical care innovations are the two components of the medical director that's really important to the staff. So you need to be affiliated with professional organizations that can give you the feedback about what's happening in the urgent care market, what are some of the changes in urgent care provider care, and that's why you're all here today. The UCOA does a nice job with that, okay? So you need to make sure that your physicians that are working for you get to read the professional literature, et cetera. And on a monthly meeting, you should choose an innovative approach that the providers, at the providers meeting, to discuss innovative care. They just had a recent article in the Journal of Urgent Care Medicine on the use of adhesives as opposed to sutures. And I think that's an excellent example of something that's coming down the pipe that's really well recognized. They've had excellent results, especially in pediatrics with facial lesions. And so that's a tool that you can use in your practice to enhance your physician's knowledge about what's happening in urgent care. The non-physician, the first line is operating management, and the second one is financial management. And those two really will drive your practice. Okay? How does the operations flow? And then how is the budget, the expenses, and the billing bringing in the revenue? What's your AR like? That needs to all be clearly defined in your startup implementation plan. Now, if you have an urgent care center and you hope that within a year you would expect to have maybe 10,000 visits, okay? You're going to start out really, really small. Well, you need to ferret out your benchmarks along the way for the year on your implementation plan. You don't wait till the end of the year and say, oh man, did we mess up? Look at this, we're not there. I've got some people look at it every day, all right? But you need to have a structured process where you're looking at the financial management and the operations, and that's this non-physician leader's responsibilities. So as an owner, you should have minimally bi-monthly reports about what's happening. And that's their responsibility. This non-physician component should also do the performance scorecard of the individuals in the clinic, including the physicians, and then they discuss it together, the physician and the non-physician. He or she is also going to be responsible for the market share performance. Now, when you open up a clinic, what good business management is you've looked at your market and you've anticipated how many visits you're going to see annually, and you've looked at the competition and you've said, well, in the first 3 months, I don't know, maybe you get 1 or 2%. In the end of the year, you want to have 10% of the market or 15% of the market. And then after the second year, you want to have 20% of the market. Those numbers are very, very important. And it's this role's responsibility to get that market share performance indice and share it with the owners and the providers. Okay? Very important. And then I've listed provider competencies that you can share in your interviewing process for physicians and nurse practitioners and PAs, because this is the expectation of what they should do. So first we talked about the responsibilities of the medical director. Now this is staff physicians, nurse practitioners, and PAs. I put this in here because it's until the past 3 years, there were no expectations and competencies for physicians, okay? And so it's important that we have a structured process to evaluate the physicians that are in our practice. And so these will help you, I think, with the medical director to put together a structured job expectation for the physician staff that you're hiring, or nurse practitioners or PAs. We also talk about there being in a position to be a leader within the clinic when the medical director isn't there, and I think that's really important, that they assume that leadership role. Here it says office, but I meant clinic, urgent care center. And it's important for them to communicate with the subspecialist when they're referring a patient out for specialty care, because this will make or break the patient experience. If the specialist says to the patient when they come in there, well, I don't know why you're here. Well, I thought the doctor at the urgent care center called you. Oh, no, we haven't heard anything. You've got to make sure that happens, and you need to make sure that the patient gets a copy of what you are going to send to the subspecialist. So that patient can then say to the subspecialist, oh, well, I was there when he called you. Here's the letter that he put together and sent you. The mail must have been delayed. End of story. Okay? So that's very, very important, because that patient will go back to you at the urgent care center, but they won't go back to that subspecialist. And in marketing, in some markets, you may have a need for occupational health practices, like there's enough employers there that might send you their injured workers, or they may ask you to do physicals for them prior to hire. Excellent revenue stream, works very, very well. But the physicians in your practice have to be aware of the difference between taking care of occupational health patients and taking care of just the general community market off the street. There are certain HIPAA regulations regarding physicals that you need to be in tune with. You can't just take a physical, document everything, and send all that documentation to the employer. HIPAA doesn't allow it. So you need to be in tune to that if you're going to do this. And then quality assurance. We are moving from a volume-oriented medical care base to a value-oriented medical care base. What does that mean, Donnelly? That means that if your outcomes do not meet the standard, you're not going to get paid. That's already happening in the market. You need to be really in tune to that and how it's going to affect you. Okay? So we want our providers to be really in tune to best practice so that you can demonstrate that the care you provide is best practice and meets the standards of care for that particular upper respiratory disease or whatever. And you need to have some standards of customer service, because what did we say? Urgent care is a customer service-oriented business. So we embrace the patient-driven mentality. You want to make sure that you assess the types of patients in your market that are going to be coming into you so you'll know what their needs are. One of the things that helps tremendously in productivity, patient access, in defining what you're doing for a patient is care mapping. Anybody ever heard of that before? It defines from the time the patient hits the door until the time the patient is discharged, what happens at every station along the way, and who touches that patient. So somebody comes in with an upper respiratory infection, they go to the front desk, they get registered, then they see an MA and they get evaluated, okay? And what's that MA going to do? The lists of tasks for the patient are listed, and then that patient may have such a distinct cough, etc., that there's a protocol the medical director has established for a chest X-ray. So automatically they would go and meet that protocol. At every step of the way that the patient is there, you define who touches that patient and what they do. Okay? So at the end, when your productivity is down, you can pull out the care maps for these patients who were in your center for a long period of time. What's the standard in the urgent care market for the time that a patient should be in the urgent care center? Anybody know? A guess. Estimate. If you can get them in and out within 45 minutes, you're really doing a job. But in urgent care, you're even a little bit lower than that, and we cut it down to 25. 25 minutes in and out. Okay? Because we don't have heart attacks, we hope. The only one who's going to have a heart attack is the owner when you're not meeting budget. And we'll refer that owner to the emergency department, so we won't have to watch it. Okay? So we have to be careful that we assess every patient. We refine the process with care mapping. That's why I brought that up. Some clinics have used comment boxes where at the time of discharge you ask the patient, did we meet your expectations? What could we have done better for you? Are you leaving with any questions? What can we answer for you? Have them fill it out. They color code these little cards, and we have the providers pick their colors. So if Dr. Smith is on Monday and he likes yellow, the cards handed out are yellow. At the end of the week, you don't have to know who is on because the colors are very apparent for the providers, and you can see what was happening there. Very, very important. Post results on the staff board. There should be no secrets about customer service. Very, very important. And color code, I tell you about that. Post-visit communication. You need to make sure that when you're hiring your MAs, that they're understandable. I know this is going to sound awful. But they present and their communication skills are excellent because they're going to have to talk on the phone. Okay? So there's and I put a positive, friendly voicemail message. I should have said a positive, friendly voicemail voice. Somebody who doesn't sound like they're so unhappy to be doing this. All right? Formal patient checkout process, that's important. So they're going to have to talk to the patient, give instruction. They need to have a very positive attitude, and they need to be medically oriented. So your MAs have to be medically oriented. And then a post-visit telephone thank you and short survey. Somebody's going to have to do that call. Usually it's an MA. So their telephone voice is very important. You want to look at your clinic, and I put this in here because you want to make sure that your reception area is clean. One of the key questions I would ask somebody who's coming in for a receptionist job is, do you feel it would be part of your responsibility to keep the reception area clean? It's my expectation. Do they feel that it's part of their responsibility? That's really important. The receptionist should consider the front desk area to the door her or his responsibility and keep it in working order and neat and clean. And so I think that eliminates common access barriers. And we need to have somebody at the front desk who can really be in tune to when to escort a patient and when to notify somebody in the back when they need help because this patient needs to go right back because maybe they have a laceration or whatever. So that front desk person has to have some critical thinking skills, okay? But also ownership of the role at the front desk. Very important. And please, people, they can't help patients if they have fingernails that are 3 feet long. It just doesn't work. So we need to make sure that there's a professional image that we're looking for, okay? Because we need to minimize wait time, so that's important. It's important there. I put this up there just to give you a feel for how to put into play some of your interviewing questions for your staff. Because what is the common wait time for urgent care centers as identified in one of the UCAOA surveys? Anybody know? 67% of the urgent care centers surveyed had less than a 15-minute wait time. That's the goal then, less than 15 minutes, because you want to be the best of the best. So that means everybody has to know their job, you have to be care mapping things, and they have to move the patient through the system. The caregiver's role in customer service is communication is number one. So you have to have people that can communicate and are good with interpersonal skills. You don't want them to sit there in the interview like this. What does that tell you about that person? Very closed. You want them to be looking at you and listening to you. You have to watch them because that's the way you want them to treat your patients. What they do with you in the interview might be what they do with the patient. So watch them very carefully. So we're going to train, and I put it up here as number one. The best training tool I've found to look at communication skills and interpersonal skills is role-playing. And you should role-play your staff with customer service issues as part of orientation. Very important, very effective. Train staff on patient experiences. This is part of your orientation process. Okay, so I'm not going to go through them. We don't have time. But I'm listing them here for you because this is what you should train them to do, that you want them to do in your center, your way. Okay, very important. And the bedside manner. Oh, man, this will either make or break the patient experience. If they're not happy with how they were treated, their perception of care is diminished. And believe it or not, it's the number one dissatisfaction component with patients. So we want to make sure we hire physicians and practitioners and staff who have a very positive bedside manner. So how are you going to find that out? References. References. And how are you going to measure the patient experience? Well, you're going to set up cards and all that jazz. Remember the incentives we were talking about? These are the monitors that are going to be part of the incentives. We want to make sure that we anticipate that people are going to have, I think if I'm going to be the best in the business, I want to have a 4.5 to a 5 scale. On a scale of 1, you really need help, to 5, you're just outstanding. That's how I want to be, 4.5 to 5 with my staff. Okay? Because if I don't set the bar high, who is? So that's what you want to do. You want to make sure everybody's aware. And for those new clinics, you really want to set up a website. That's the ultimate. And on the website, have a process for a patient portal. So the patients can go in after their visit and get educational materials, but they can also complete their surveys. Then there's no paper involved. Okay? Excellent tools. Here's a sample of a customer service component you can use in your interviewing process. These are the expectations, what team members need to do, and what team leaders need to do. And then the components of a patient service team. I put this in here so that you can share with your prospective employees and see how they feel about each of these components. And each of them are designated and have more follow-through on them. And so that's here. And that tells you how employees contribute. I think what we have here, guys, is they took my slides from my last presentation and provided you with them for this presentation. And so that'll be great. This is about customer service, but this is what you would put in your orientation process for customer service. All right? In the manual, you should have received, you should have received some salary expectations. That's not here. So the salary expectations I wanted to share with you, after we talked about coping strategies, etc., you may have those in your manual. We talk about the role of the MA and the nurse, and I explained what the specific tasks were. I talked about core components of orientation, and then I talked about specialty training, and you got some of that. But I also talked about how much staffing was going to cost you, and that would have been around slide 11 or 12. No, 1, 2, 3. Let me just give it to you. The norms for physicians. Does anybody have that in your handouts, or did you have what I just showed you? You have what I just showed you. Okay. Well, just so you're aware, and I'm going to read this because I don't have it memorized. The national averages for salaries in urgent care, physicians 166.4 to 250,000. That's a big scale. Why is that? Because in certain areas you have very, very, very high needs, and in other areas they may not be as high. Okay? Directors 72,000 to 90,000. That's that program manager role. Radiology techs 37,000 to 54,000. 37,000 to 54,000. Medical assistants, and this is the worker bee of your clinic, 27,000 to 41,000. Registered nurses 42,000 to 65,000. Nurse practitioners or PAs 80,000 to 110,000. And then administrative support, your billing, that kind of thing, 25,000 to 32,000. Now, if anybody missed those, you want more on that, email me. You've got my email address, and I'll be happy to, yes? Okay, wait a minute. After the program director was the radiology tech? Right. Remember, in our dyad, we had the medical director and then the program manager or program director, non-MD. A receptionist would be the administrative support person. Under that, you would also look at billing, okay? Administrative, clinical stuff. Yes? It depends on your market. And so it depends on how many physicians. You would look at, for every one physician, you need 2 MAs. And so it depends on what your anticipated volumes for the year are going to be. The RVUs for a provider for a year is, I think it was 52,000, anticipating $114 per visit. And those are the national norms. So you would need to know what your anticipated volumes were when you're looking at your marketing strategy. If I anticipate that I'm going to see 10,000 visits for the year, I want 1 physician, 2 MAs, and 1 part-time nurse practitioner. How do I know that? Because of the productivity components. It's estimated for your urgent care center that a physician needs to see 5 to 6 patients in an hour, okay, to be productive. Those are the UCAOA standards. So, how many patients are you going to see in your market? Some clinics start up real slow. So if I'm a startup, I'm going to start up, I don't want to say real slow, but my core program components, I'm going to hire a medical director, and I'm going to hire a staff doc, and I'm going to hire 2 PAs. because my medical director is going to be doing some marketing and overseeing, et cetera. When my volumes expand, then I'll add more staff. Did that help? Thanks. Excuse me? Medical director salary was really $166,400 to $250,000. So if your medical director is functioning as an initial staff person, then it's a little bit higher. If he's just doing medical directorship, then it's a little bit lower.
You did mention in the beginning that some states, the medical assistants would be allowed to do x-rays as well.
Right.
State to state. So where would be the most updated guidelines for that?
You need to look at your State Practice Act. So literally, I would go in and Google your state and the Practice Act, and then you'd have to read to see what they can do. Any other questions? Yes. Wait a minute. I think the question is, would you go and get a medical assistant straight out of school? Is that what you're asking?
No, means just get extra help.
Oh, as a student, to have them on board. Any student, like nurse practitioners, like physicians who are in family practice that want some work in the urgent care center, MA students, that's an excellent addition to your staffing. It keeps everybody on their toes, too, because they're going to have, if they know that they're going to be teachers for people coming on the pike, they're going to have to be really up there. Also, you'll have to have the infrastructure developed in your clinic to demonstrate what are the competencies they're going to be learning and how are you evaluating them. So there's some paperwork to do with that. So you get what you pay for. Well, not necessarily, because that free help sometimes is invaluable, because when they graduate, they'll come work for you when you get clinic number 2, number 3, and number 4.
I have a question about those salary numbers you gave us. Were those including benefits, or that's the...
No, no benefits.
So that plus benefits?
Yes. Now, benefits differ in each market, and thank you for asking that. In some markets, benefits for salaries can be as low as 12 to 16%. In other markets, they're a lot higher. So you have to be competitive with your salaries. And who are you competing with? In some markets, you're competing with the hospital. They go 31% in benefits sometimes. They don't know when to stop. So, you know, there are issues there. Any other questions? Thank you all very much for your understanding about the slide glitch. I really appreciated you all. And you have a great time in the receptions outside. Thank you.